Good evening and welcome to the NAACP Pennsylvania State Conference virtual town hall meeting. Tonight, we focus on the impact of COVID-19 on communities of color. We do have a full roster tonight, so we want to make sure that we move this webinar style meeting along smoothly. So just to begin, we do have some Zoom etiquette we'd like to review with you all. Again, welcome, and we're so thankful for you taking out time to be with us tonight to become more informed. It is webinar style, so the only voices and faces that you will see in this virtual town hall are those of the presenters and facilitators. I am your Zoom host, Shana Watson. Our co-host is Jamil Reese. So we will be navigating the panelists and attendee tabs as well as the question and answer tab. So tonight we do have with us our president of the state conference, Kenneth Houston, as well as our vice president and economic development chair, Blandon Watson, and I will introduce them shortly. So in terms of the Zoom etiquette, again, we invite you to utilize the speaker view depending on your device. If you are on a laptop or computer, the speaker view is in the upper right-hand corner, and that allows you to either see all of the panelists in the little squares fully screened, or either you can just focus on whoever is speaking. That is your speaker view option. Also, the Q&A option, you are invited to pose a question, and we are being realistic with our time that we might not get through all of your questions, but we will try our best to be able to pose your question to our presenters tonight. Dr. Rachel Levine is only with us briefly, so once she presents, we'll be able to get one or two questions to her, and then we'll move on through the rest of our presenters. We are also aware of potential Zoom disruptions, also known as Zoom bombing. Please know that we will take care of it expeditiously should in the event that arise. Otherwise, we will keep the meeting flowing. This meeting is recorded and will be archived and posted on our website and shared with media upon request. So with all of that said, again, we are grateful for you all, and we're looking forward to hearing from our vice president and president. So up first, we do have the Vice President and Chair of Economic Development, Blandon Watson, who will speak a little bit about the purpose of tonight, and followed by him, we will have remarks from the President of the NAACP PA State Conference, Kenneth L. Houston. Blandon?
Good evening. Thank you for joining the virtual town hall sponsored by the Pennsylvania State Conference of the NAACP. I wish everyone the safest passage through this health and economic crisis, and thanks to all of our speakers who are here with you today. Our message emphasizes NAACP's economic empowerment agenda: learn, build assets, monitor financial institutions, and civil rights work in our 6 game changers of the NAACP. Additionally, in the time of the pandemic, we must monitor and document particular effects on communities of color and guard against racist reactions, and to be aware of their policies and practices for people of color. We can work individually on our own economic positions, but for too long, people of color have gotten the short end of the stick from financial institutions and many others. We must monitor and hold accountable people and institutions who control access to resources. We must not allow the economic crisis to hide the fact that the financial pain will be unfairly distributed, and watch for structural racism in financial institutions and others. This is the NAACP's economic development agenda each and every day, but this time in the pandemic brings unprecedented challenges. Communities of color face different exposure to and results from the COVID-19 virus in regions many are familiar with. Increased joblessness numbers means less incomes. High rates of incarceration and chronic health issues among seniors make minorities vulnerable. Access to good health care is limited. The coronavirus magnifies all the disadvantages that structural racism heaps on communities of color. We must advocate for documenting these inequities. We must press for the attention and resources needed in our communities, but there is another insidious result of the differential impact on the virus. Racism and stigmatization have increased in the most vulnerable populations. As people of color become strongly associated with the virus, stigmatization will increase. We must guard against it. Combat the coronavirus in our homes and communities by following the best guidelines of informed leaders, but do not allow the pandemic to hide or excuse challenges to civil rights. Join me and everyone in our state nation, and world in building toward a bright future after this virus. Thank you. And welcome to all who has come.
Thank you very much, Vice President Blanding Watson, for your words, your opening remarks. And next we'll have President Kenneth L. Houston.
Thank you, and good evening to everyone for joining the Pennsylvania State NAACP on our virtual town hall meeting. Tonight, we are privileged as the oldest civil rights organization, and particularly the boldest civil rights organization in our country, and particularly in our state conference, to have a plethora of panelists who have joined us tonight, who bring in their own respective areas expertise and things that we are facing in this Commonwealth. We're privileged and extremely grateful to our governor, Mr. Wolf, who has allowed these wonderful individuals to come and join us tonight. We look to them for leadership and guidance as we face some of the most crippling situations in our country that we've seen in over 100 years, if I'm correct. I will say this, and I say this very humbly, we are extremely grateful to Dr. Levine and to all those that are in the Wolf administration for their guidance and leadership through this time of uncertainty. One of the things that we particularly see when it comes to people of color and African Americans respectively, that this pandemic has wreaked havoc. And we do know that it's going to take a lot moving forward to overcome all that has happened. We're prayerful, we're hopeful, and as the first vice president said, we don't want any stigmas to come out of this to create any more hate or racism that may evolve from this situation. Again, on behalf of the Pennsylvania State NAACP, we're thankful to all of you for being with us tonight, and we're looking forward to all the things that you're going to bring to the table, and it's our hope that you will come back and join us again. So with that being said, thank you very much.
Thank you very much, President Houston. We are now entering into our presentation portion of the virtual town hall. Each presenter has been given several minutes to present in their particular field about the impact of COVID-19 on communities of color and African American communities and underserved communities. And the first person who will be speaking really needs no introduction, and I'm a huge fan, so I get to put that in there. But we have up first, Dr. Rachel Levine, the Secretary of Health here in the state of Pennsylvania. Dr. Levine.
Well, thank you so much for allowing me to speak with you tonight. It's a real privilege. And so COVID-19 continues to present a significant public health threat to the United States and to Pennsylvania. Today, we reported that there are over 45,000 cases of COVID-19 in Pennsylvania. Tragically, there are now over 2,200 deaths due to COVID-19 in Pennsylvania. The areas of Pennsylvania that are the most affected include the Southeast, Philadelphia, and the suburban Collier counties, but also the Northeast, including Lehigh County, Luzerne County, Northampton County, and others. Other parts of the state are certainly affected. South Central Pennsylvania, Dauphin County, Lancaster County is very impacted. And of course, Allegheny County in the west has been very impacted. We tend to see more cases of COVID-19 in more population-dense areas. Thus, the highest rate is in Philadelphia, which has almost over 13,000 cases of COVID-19. We're seeing less cases in more rural counties of Pennsylvania that are less population dense, and that is to be expected. Other areas that are very impacted are seniors, but particularly seniors in long-term care living facilities such as nursing homes and personal care homes. We saw more than 8,000 cases now in those facilities. and 1,000 staff impacted in those facilities, and tragically, actually, over 1,500 deaths in long-term care living facilities, and that is 2/3 of all the deaths that we're seeing in Pennsylvania are in those facilities. But other congregate care facilities are impacted. We're very concerned about the impact in terms of the state corrections system, the state prisons, but also then county correction institutions as well. And we've done a lot of work with Secretary Wetzel on that, as well as with certain counties. I think that you're entirely correct when you had said that minorities, vulnerable populations are at particular risk, communities of color, African-American communities, and we have seen that in terms of disparities in terms of testing and treatment. And so that's something that the Wolf administration is particularly concerned about, and we're working towards that. The Lieutenant Governor has a specific task force to address that, and within the Department of Health, in our Health Equity Department, we have a work group that is working on that as well. And then actually in a Path Forward work group, there's a specific subcommittee in terms of vulnerable populations, communities of color. We need to be careful about stigma and discrimination rearing its head at this very challenging time where we are seeing COVID-19. The next step, we have been able to bend the curve. We have been going up in terms of an exponential rate a month ago, but we have been able to bend the curve. We need to continue to do that in the Southwest, in the North, in the Southeast, and the Northeast. But we are going to start to have a path forward phased reopening. The governor will be making announcements about that tomorrow. It'll be a while before Philadelphia and the Southeast is able to get there, but we're going to all work towards that under the governor's leadership. So I want to leave, I know, time for several questions, and so I'm pleased to answer any questions now.
Okay, thank you so much, Dr. Levine. I'm going to turn it over to Jamil Reese, who will do the Q&A for you.
All right, Dr. Levine, the first question I do have for you is, what is the plan for the incarceration person?
So we have, from the beginning, have been working with Secretary Wetzel, the Secretary of Corrections, in terms of state correctional and policies for state corrections, which then are also promulgated down to county corrections as well. So some of that has been very, very challenging because there has been a universal lockdown that was done to prevent spread of COVID-19. We have had policies in terms of testing and making sure that individuals who have symptoms get tested, in addition to then isolation, contact tracing, and then quarantine of those that were in contact. We have had a number of cases in corrections that have been very challenging, but overall I think that it has been successful in county corrections. There was a study actually done, I believe, in Chester County, or maybe it was Delaware, one of the Collier counties, testing asymptomatic individuals in their county corrections. And there are cases. People can be a completely asymptomatic and still have had COVID-19. So it shows how challenging this virus can be in terms of preventing spread. But we have been working with Secretary Wetzel every day in terms of preventing the spread in corrections.
Thank you. You have plenty more questions, but I'm going to go with this one. Is there any study about the effect of the virus in Black people and in minorities?
There have been very few studies, but what has been shown is that seniors are more at risk, and individuals with other comorbidities are more at risk, such as heart disease, high blood pressure. We know there's an increased incidence of high blood pressure and hypertension in African Americans. And so I think that we need more and more studies about the impact on minorities and on African Americans. To do that, we need more testing. And the other challenge we have had is that it is required when people do testing, when healthcare providers and when the laboratories do testing, to fill in on our information system race and ethnicity. That is a required field. what we have found is that they don't do that. And so we are working really, really hard with all of our healthcare systems, with our hospitals and laboratories to make sure they fill out that field so we have the data to be able to study what you just talked about.
Thank you. And one more last question. Is there any type of federal support for the testing that is coming through?
So there is federal support for testing. You know, the testing rollout from the federal government has been challenging and was particularly slow in February and in March, and we had significant shortages of the different chemicals and reagents and materials we needed to do for testing. That is much better now. We had a call with the federal government a couple of days ago. We're going to be getting the swabs and all the materials for testing, the different platforms and chemicals we need for testing, not only our laboratory, but also the commercial laboratories and hospital laboratories. So we are relaxing our criteria for testing significantly. Previously, it was healthcare personnel, those in congregate settings like nursing homes, as well as corrections, and those 65 and older. We have relaxed that now to be testing really anybody with symptoms. And we want to be able to roll out many different opportunities for testing, and particular to communities. So whether that's urban communities, rural communities, and even and suburban communities, we want to make sure that we are targeting those communities and making sure that we can get that testing. So we finally are getting the support from the federal government to expand testing.
Perfect. Thank you.
So I guess the last words I want to say are words of hope. You know, I think that hope has been hard to come by over the last 2 months, especially with the stay-at-home orders, the closure of non-essential businesses, and the cancellation of schools. And as we see the numbers go up in Pennsylvania, and we see the numbers go up nationally, I think that hope has been really, really hard. As we saw the challenges that New York City faced, that New Jersey faced, I think that we were all very concerned that Philadelphia and the Southeast in particular, but other areas of Pennsylvania could be overwhelmed by cases. But we have, through everyone's efforts, and everyone staying at home when they could, and limiting their outdoor activities, wearing masks, washing their hands, everything I say in my talks, we have been able to bend the curve. I think that we are past the initial peak, the initial surge that we were talking about. But we need to keep it up. We need to continue all of that work in the Southeast and the Northeast right now. And even as we start to go from the red phase, close down phase, to the yellow partial opening phase, which the governor will announce tomorrow, we still have to be very vigilant to prevent the spread of this virus. But I know that Pennsylvanians, and the governor knows that Pennsylvanians want to do the right thing. And with all of us working together, we're going to get past this global pandemic together. Thank you.
Dr. Levine, thank you so much. And thank you so much for presenting and answering all those questions. We have so many questions for you in the chat box, and just recognizing that this issue, how complicated it really is. So again, thank you for being with us tonight. And I'm sure we could easily spend the next hour and a half just with you alone. However, we will get on with the rest of our presenters. Thanks again for being with us.
Thank you very much. Take care. Stay safe.
Absolutely. So next we have with us Lieutenant William Slayton from the Pennsylvania State Police Heritage Affairs.
Yes, good evening. Thank you very much. Thank you for having me, and thank you to the NAACP for hosting this panel to bring attention to such an important issue affecting communities all across America, minority communities in particular. So the Heritage Affairs section is a unique entity within law enforcement. Our section monitors and responds to hate and bias crime that occurs throughout the entire Commonwealth. Many law enforcement agencies don't have a particular unit dedicated to responding to hate crimes, but the Pennsylvania State Police does, and I command that unit along with several members below me, under me, that help me better serve the Commonwealth. They're strategically located throughout the Commonwealth, and they represent minorities within the Commonwealth, so we can better resonate with the different minority groups throughout the Commonwealth. So hate and bias type crimes, they have a particular heinous impact on the victim as well as the victim's community. With the rise of COVID-19, we're tracking hate crimes against Asian Americans throughout America because of several misconceptions surrounding the virus. But we're also tracking law enforcement response to communities of color, so to speak. Not too long ago, there was an incident down in Philadelphia where a young African-American male was removed from a public transportation for not wearing the mask. And we don't want incidents like that to occur. So my unit also provides training to law enforcement, free training to police agencies throughout the Commonwealth in subjects such as racial profiling awareness, cultural competency, as well as de-escalation techniques. We monitor on a daily basis hate crimes occurring throughout the entire Commonwealth, in particular those with respect to COVID-19. And as of now, I can say that there have been no hate crimes occurring throughout the Commonwealth related to COVID-19 that the Pennsylvania State Police has investigated. I'll say that again. The Pennsylvania State Police has not investigated any hate crimes related to COVID-19. Now, if there are bias type incidents affecting communities of color and it's brought to any member of the NAACP or community leaders' attention, please let me know so I can reach out to that respective law enforcement department and offer some type of training so they could be a little bit more culturally competent when it comes to dealing with minority communities. We all know, because we're of color, we know the systemic issues that have plagued our communities, the history of policing in America, how policing came to be with the slave patrol, and how communities of color are not trusting of law enforcement. And it's going to take some time to get over that. And this COVID-19 pandemic, unfortunately, it really doesn't help. You know, when you have young African-American males wearing masks, walking into stores and walking through communities, unfortunately, that increases the possibility of them getting profiled by law enforcement agencies that are not as competent as they should be, or culturally competent as they should be, so to speak. So again, if anything like that were to happen, please bring it to my attention right away so I can reach out to that respective law enforcement and make sure they have the proper training for their officers going forward, so we don't have a national tragedy like they've had in and across America. Lastly, I would just like to say, this is something that we really have to get through. It's trying times. I've had friends of mine calling me, asking me what to do. Should they wear a mask? Should they not wear a mask? And these are tough times. So we all just have to stick together and treat everyone with respect, and eventually we'll get over this. So thank you again for having me, and I look forward to working with you all going forward, even after this pandemic is over. Thank you.
Thank you so much, Lieutenant Slayton, for your presentation. And it's great to know that we do have a specific department in our Pennsylvania State Police that focuses specifically on hate crimes and the effect of COVID-19 on communities of color. We will continue. We'll probably have some questions for you during our Q&A. So thank you again for your presentation.
Yes,
Up next, we do have Mr. Norman Bristol Colon, the Executive Director of Census 2020 Complete Count Commission in our Economic Development Department. Norman.
Thank you. Thank you to the NAACP for having me tonight. And before I go into my brief remarks, I would like to echo the words of Shayna Watson in regards to our esteemed colleague, the Secretary of Health, Dr. Levine. I think that we are so blessed in Pennsylvania to have Dr. Levine as the Secretary. In my estimation, she is the best Secretary of Health in the nation, and we are so lucky to have her during this pandemic. When it comes to COVID-19 and the issues that are impacting many of the communities of color, I would like to look into many aspects. First, we all know that many of the Latinos that are working in Pennsylvania, they earn less than living wage. And unfortunately, many of the places that remain open during this pandemic were these places that these Latino and individuals of color they work in, and that's why we have such a high number of cases of Latinos with the pandemic in Pennsylvania. Another aspect that I would like to look into it as well, especially because we are talking about how this COVID-19 is impacting communities of color, is when you look at the migrant and seasonal farm workers, not only in Pennsylvania, but across the nation. 80% or more of migrant and seasonal farm workers are Latinos. They have to work because they are the one providing the products and the food that we put in our tables on a daily basis. Yet, I believe that because of many barriers, social dynamics, they are the ones that are not getting tested. They are the ones that possibly are sick. They are the ones that are possibly dying. And what are we doing about it? It is important for us to recognize that during this crisis, these individuals of color, especially, in my brief remarks talking about the Latino community, they are in the front lines providing to the American family, not necessarily the health care, but they are providing what we need to sustain our lives. And they are working in the migrant and seasonal farm work. They're also working in the supermarkets, in the pharmacies. And if you look at where this COVID-19 is impacting Pennsylvania, I would like to even go deeper, because it's going to places like Berks County in Reading, where we have the largest concentration of Latinos. And you see that more than 2,600 individuals, they have the virus. In Lancaster, over 1,700 individuals. In the Lehigh Valley, in Lucerne, in Philly, in York, in Northampton. All this, when you combine all these counties together, is where we have the highest concentration of Latinos living in Pennsylvania. The almost 1 million Latinos live in these counties, and yes, is where we have the largest numbers of Latinos that have been impacted with this pandemic. And if you allow me, let me just say this as well. They don't have the highest number of individuals with COVID-19 in these communities that are Latinos because they are not following the recommendations. That is not the case. Let's not be ignorant about it. They have it because they are the one working. They are working in life-sustainable jobs, making sure that the economy continues to move forward. If there's something that we also need to look into it, even when we are doing such a great job and we are so lucky to have the governor and Dr. Levine, in their respective positions, we really need to look into data. Because now that we are facing this pandemic, we don't have the data for us to go to our own communities and say, for prevention measures, the numbers are coming from here. This is the Latino community that have been impacted. This is the African American community that have been impacted. And data doesn't lie. So now, even if we want to really be accurate in providing the information in the Spanish language, we don't know because the data was not collected. And that's why it is so important that we look into this. The language barrier has been another big issue when it comes to this pandemic in the Latino community of Pennsylvania. I think that when we are talking about emergency management and preparation into the future, we need to take into consideration, the language barrier as well, and where these testing sites has been located. Are they close to these individuals of color? Are they far away? Because there have been many complaints that the testing sites have not been really welcoming to individuals of color, and especially those without the English language skills. And finally, let's look at the pandemic after this pandemic. We all know that the pandemic right now is a public health issue that is happening globally. But let's look at this pandemic, the pandemic after the pandemic, and it's going to be economics. It is going to be economics because individuals of color, they have, during this pandemic, pay cuts. They have been losing their jobs because of this pandemic. And this is going to continue to be for many, many months. And finally, when we are looking at the census 2020, this is more important than ever before, that we make sure that we count African Americans and that we count Latinos in the US Census, because we know that the allocation of resources, the allocation of funding during this pandemic, during this crisis, have been connected to the census numbers. And we have to make sure that in Pennsylvania, we count every person of color, so we will never face this challenge of allocation of funds in places where our community is and the allocation of funds are not there. You know, it is undeniably that the pandemic is disproportionately killing Hispanics and African Americans in our nation, and we need to do a better job, I think, not only in Pennsylvania, but all across the United States.
Norman, thank you so much for your presentation and for highlighting how systemic racism manifests itself in spaces like this, in terms of underreporting and people on the front lines that don't have access or easy access, especially with the language barriers and such. So we look forward to hearing more from you moving forward. So next we have, as our presenter, we have Jerry, our Secretary of Department of Labor and Industry. Jerry.
Good evening, Shane, and good evening, President Houston, and thank you for the opportunity to be here with you. It is an honor to speak to such a historic and prestigious group, and I'm really pleased to be here. As President Houston said, this is a time of great uncertainty and great challenge, and particularly for us in state government. One of the main roles that we have in the Department of Labor and Industry, one of our bigger departments, is unemployment compensation. And as we all know, the pandemic has hit and hit hard the economy. Just to put some numbers around this, put this in some perspective, in the 3 weeks before the mitigation efforts began, before the pandemic really, we had to address it the way we are, we had 40,000 total new unemployment claims. Within less than 3 weeks after those efforts, we had over 1 million. Our highest year ever was in 2010 during the recession back then, and we had 800,000 new claims in the entire year. And we have right now, in 6 weeks, 7 weeks, we have 1.7 million new claims. So we are facing just an unbelievable challenge in our agency. And we have responded. We have been able to, through our traditional system, distribute $2.7 billion. I wanted to get the figure right here. $2.7 billion in benefits have been distributed since March 15th. And with the addition of the Federal CARES Act, we've been able to distribute another $900 million. That's the extra, part of that is the extra $600 as part of the federal pandemic unemployment compensation piece. So we've distributed about $3.7 billion in benefits since this pandemic began. Now, I know that when you're on the right side of those statistics, that's a great thing. But if you're some of the people that are having trouble getting through, have questions about their claim, and just having difficulty reaching us, those good numbers don't matter to you. And we're very aware of that. We're very concerned that we make sure that the benefits that our fellow citizens are entitled to, they receive. And we're doing all we can to get those benefits out the door. We aren't immune to this COVID-19 either. Our family, our friends, our neighbors, our relatives are impacted, as are all of our citizens. So we have taken a lot of steps within the Department of Labor and Industry and within unemployment to address this unprecedented number that we are facing. We've got 500 staff in UC right now in unemployment compensation that are answering phones, checking claims, answering emails, and we're adding more all the time. We've brought back close to 100 retirees that are working in the system, people that had worked in unemployment compensation before. We've got about 500 staff from other agencies across the Commonwealth. My colleagues on the cabinet have been very supportive of the work we're doing at Labor and Industry, and they've offered to share some of their staff, and we're training them and putting them to work. We've are in the process of hiring 250 new intake interviewers. We've got 100 ready to go. Their training begins in a week or so, and we will be getting them answering phones, responding to emails. We have upgraded our technology. We've got we've made some changes to our system, which is old. It's a 40-year-old system in the process of being replaced in October. That doesn't help us now, but we will have the system replaced in October. We've added some upgrades to that system. We've also brought on some artificial intelligence, the Watson program from IBM that has answered over 35,000 calls. Part of what we are responsible for, as I mentioned at the start of the remarks, is the implementation of the Federal CARES Act. And that's three particular parts of that we're responsible for. One is the extra $600 that people who receive unemployment will receive, and you don't have to do anything. And once your claim is in the works, you will get that automatically. It doesn't arrive at the same time as the regular benefits, and Susan can help answer some questions as people have them later on. But that's a part of what we're doing, and that's where the $900 million plus in benefits have been dispersed. We also have the Pandemic Unemployment Assistance, the PUA program, and that is the program for people who are not traditionally eligible for unemployment. That includes self-employed, gig workers, people with 1099s, and some other folks that are that fall into that particular system. We had to create a separate standalone piece of technology, a different system for that. We were not allowed to mix those funds according to the federal government standards. We could not mix those funds with our traditional system. So it took a little bit longer to get the regulations together and to get that system up and running. We did get it up and running April 18th. And in that time, between now and April 18th, we've processed over 120,000 claims. And we hope by the middle of May to get those benefits out there. So we have been very, very busy in the Department of Labor and Industry, particularly with our unemployment piece. And we know that unemployment does impact communities of color more so. The unemployment rates are higher. People of color are impacted first when these things happen. And it's important that we are as responsive to our fellow citizens as we can be. So with that said, I'll move on, and Susan and I will take any questions when they're here.
Jerry, thank you so much for highlighting what the Labor and Industry Department are endeavoring to do, especially with the $900 million that is being distributed. So we look forward to hearing more about that during our Q&A in a little while. So next we will have Susan Dickinson, the Director of Unemployment Compensation Benefits and Policy. Excuse me, UC Benefits Policy. Susan.
Thank you very much, and thank you everyone for being here. You know, the Secretary gave a nice overview of what's happening in the world of unemployment right now. So what I will do is give you more detailed nuts and bolts type of information. Everybody, of course, their big concern these days is how to contact us. There have been plenty of people who've successfully filed claims and are getting paid, and as the Secretary said, that means nothing to you if you're not on that side of the statistics. So I'll give you a few pointers. For starters, the best way to contact us and get information is to use our website, www.uc.pa.gov. About 3 weeks ago or so, we upgraded our website so it is mobile responsive. It was not prior to that. So if you filed a claim more than 3 weeks ago, you probably had a tough time on your cell phone, or maybe you had to borrow someone's laptop. It is now smartphone responsive, so you can use our website, you know, wherever you are. Our website and our application are also in Spanish, so you can access the Spanish site if you get to our regular site, if that's what you need. We do have a lot of information, very comprehensive information on our website. It's a large website. We have a lot of frequently asked questions that could help a lot of people and save them time if they find their answer in the frequently asked questions, they won't need to contact us. Some of what we've seen is basic understanding of unemployment isn't really there because it's a complicated program. Even without the pandemic, it's a very complicated program. So it's, a lot of people may not understand that it's kind of like a paycheck. When you first open your claim, you're not going to receive payments right away. When you open your claim, you're just telling us, hey, I'm unemployed now. It looks like I'm going to be unemployed for a little while. So what we do then is we send you all the information you need. And at that point, it works like a paycheck, just as if you worked for 2 weeks, you submitted a timesheet, and then you got paid a week or two later. Unemployment works the same way. You're unemployed for 2 weeks. You submit what we call a biweekly claim for benefits, and then you receive payment a couple days later. So it's not an upfront payment, it's an after the fact payment after you've been unemployed. So we have some basic flow charts and things on our website that can help with basic unemployment understanding. There's a lot of information about PINs. A lot of people are concerned if they didn't receive their PIN number quickly. We had a backlog at the beginning of the pandemic, but we're caught up now. And so if you open a claim now, you should get your PIN soon. But we do have a spot on our website where you can request a new one if it's been about 3 weeks and you still haven't received anything. There are other reasons that we have on our website. If you had out-of-state wages, your claim might be delayed while we reach out to the other state and get your wages. If you didn't receive a debit card, a lot of people ask that question. And if you had an unemployment claim before within the last 3 years, you have a debit card and that's the active one, so you won't receive a new one. There's very simple questions like these that you can find on our website. For those people who don't have any internet access, and there are plenty of those people, we have partnered with IBM with their Watson machine. You may, be familiar with Alexa and asking her any type of question. We call our unemployment bot, we call her Paula. And I will give you her phone number and you can call her. She can't connect you to a live agent, but you can ask her these questions and answers and possibly find an answer to some question that you have. Her phone number is 877-978-1295. And she's available 24 hours a day, 7 days a week. If it does turn out that you need to contact us for some reason and you prefer calling, of course, everyone knows that calling us is difficult. We did recently expand our hours. We are taking phone calls from 8 to 4 each day, Monday through Friday. Staff work longer hours than that and on weekends to process work, but those are the phone hours. It's best to call us later in the week. Mondays and Tuesdays are always the busiest days. So trying Thursdays and Fridays, you'll have better luck getting to us. Each week we've been taking about 22,000 phone calls. So we are taking plenty of calls and plenty of people are getting through. And our main phone number is 888-313-7284. For anyone who needs a translator, we do have a translation service that we use so that, if you need that, we can get the translators on the line and file a claim that way. Also, we have a live chat feature on our website, which also has become very busy. So we've expanded the hours of that from 7 a.m. to 6 p.m. each day. So you can go to our website and use the live chat feature if that's a way that you want to get a hold of us. And we do also have an email address. The email has been overwhelmed, and right now we're about 4 weeks back. But if it is something that doesn't need to be more urgent than that, but you do have a general inquiry that could wait, the uchelp@pa.gov website, so that, or email address, so that's uchelp@pa.gov. You can send a message there and someone will get to it. We've noticed that we've had a lot of duplicate emails, and so what we're doing is working to get software to try to remove some of those duplicate emails. So our 4-week time frame might actually be shorter than that. So we're working through that as we can. One more note about a federal program that's coming live very soon is the Pandemic Unemployment Assistance. This is the program that's for those who are self-employed and also those who don't traditionally qualify for regular unemployment. They might not have enough of a work history, for example. The application for that program was up 2 weekends ago, and within the week, we're going to have the full application up so that we can process continuing claims and payments. And so that will have its own phone number, which we will publish as soon as we get that. And it also does have its own email address, ucpua@pa.gov. They will only respond to PUA requests at that address. So thank you very much for your time. That's all I really wanted to share with you. And I appreciate you, listening to the information that we have to give you and being able to help each other through this.
Susan, thank you so much for explaining the various ways that people can gain access to filing and asking questions, and also letting us know and being transparent about the fact that there is a backlog and that, some things are moving along a little bit slower. So thank you again for your honesty and your transparency and your presentation. So last but not least, we have Robert Torres, Secretary of the Department of Aging. Robert.
Thank you, Chena, and thank you for having me here this evening as part of your town hall. I'd like to start off with just telling you a little bit about the Department of Aging, because I have found since I assumed this position that very few people understand what we really do. And our primary functions at the department is to advocate for, serve, and protect older adults, 60 years of age and older. We're governed by the Older Americans Act, which is federal law as well as Pennsylvania state law. And it's important for this audience to know that the Older Americans Act specifically calls on us to be visible and effective advocates on behalf of older individuals, and to ensure that programs and services that we provide focus on older adults with the greatest economic and social need, with particular attention to low-income older adults, including low-income minority older individuals, older adults with limited English proficiency, and those residing in rural areas who might be socially isolated. And again, in the federal law itself, and I want to read the definition because again, I think it's important when we talk about holding agencies, organizations accountable, this is important to know. The term greatest economic need means the need resulting from an income level at or below the poverty level. And the term greatest social need means the need caused by non-economic factors, which include physical and mental disabilities, language barriers, cultural, social, or geographical isolation, including isolation caused by racial and ethnic status that restricts the ability of an individual to perform normal daily tasks or threatens the capacity of the individual to live independently. So that's important. That's something that we have been working on in the department to make sure that diverse communities that typically haven't understood what we do at the Department of Aging, or perhaps the agency has not done as much outreach as we could be doing. And we've seen challenges here during the COVID-19 to make sure that communities understand the types of services that we provide through 52 area agencies on aging, who act as our agents out in the field supporting all of Pennsylvania. The reason this conversation is important, and this is something that I typically mention at any remarks that I give, over 3 million Pennsylvanians right now are over the age of 60. That's 24% of Pennsylvania's total population. 13% of that over 3 million number are minorities, with African Americans making up 7.5%, Latinos making up 2.6%, Asians make up 2%, and then other groups like Native American, Hawaiian, Pacific Islanders, or individuals who are a combination of different groups make up the additional 1%. So that's where we're at. But over the next 20 years, that number is going to grow by about 1 million. So Pennsylvania's population in 20 years will be at almost 30% of individuals over 60. So COVID-19 forced us to close senior centers and adult daycare centers, which are important facilities where seniors go to engage socially, to be fed, and to attend classes, to engage in activities that help them not be socially isolated. In the case of adult day centers, they typically see individuals that require that have higher healthcare needs, than someone who would be attending a regular senior center. So when we shut them down, we had to make sure that we were make sure that their nutritional needs were being met. So a lot of individuals who were getting their meals through these centers had to be shifted to home delivered meals or meals that could be picked up at curbside or grab and go meals. So the whole issue of nutrition and making sure that no one goes hungry during COVID-19 has been a priority for the governor and the first lady. And we've been working very hard to make sure that there are no gaps, and where there are gaps that we can fill those. We provide home and community-based services, again, for people who are not eligible for Medicaid. And we've relaxed some of those rules so that individuals during this pandemic who need those services can get them without too much burden, without requiring face-to-face contact, so that there's no exposure to the older adult or to staff. We've also relaxed some of the rules in terms of protective services. So one of our key functions is to investigate reports of elder abuse. And except for the most serious imminent risk of bodily and physical injury or sexual abuse, we are not requiring anybody to go out. Basically, we're encouraging them to do whatever intake is necessary via phone, ask for medical records to be faxed or email, and handling as best we can that way. We have an Office of Long-Term Care Ombudsman. So these are individuals who follow up and investigate complaints in long-term care facilities. And those are services that we offer to residents and their families if they have a complaint, a grievance, or concerns with individuals in long-term care settings. And we follow up on that and coordinate with Department of Health and Human Services as needed. And finally, we have a service called PA Link, which is an information and referral services for anyone, regardless of age. So it's an aging and disability resource center. So anyone who needs support can get support. And another important thing that we do is prescription. We have our PACE program for low-income individuals that qualify. There's 2 different income limits. So if they qualify, we can get them help with their medication. But we also have what's called the Patient Assistant Clearinghouse Program. And this is our team with the PACE program does an excellent job, since they know pharmaceutical companies. They're aware of discounts. They're aware of programs that even if they don't qualify for the PACE program, they can come in and we will try to help get them the support they need on medications. So we've been working very hard trying to look at ways that we can make sure that we're communicating properly with diverse communities. We are looking at models that are out there to address social isolation, which has been another big concern with our community. I've looked at programs such as SAGE. SAGE deals with issues on LGBT advocacy and training. And what they did was, for LGBT seniors who were alone and needed some level of support, they set up a portal and called it SAGE Connect. So it's a way for individuals who felt they needed some level of support with another individual that could understand some of their needs and some of their concerns, where they can connect and make those connections and engage with each other during this time. Social isolation is a big issue for us. We're seeing a lot of interest in it. We have universities that are approaching us to work with us on things that we can be doing. We have a partnership going with AARP, where we're going to try to get telephones and tablets into nursing homes so that those residents have more contact with their families and friends and don't feel isolated. There's a lot of work to do in terms of the disparities that we're seeing. I formerly worked at the Department of Health, and data is so important. One of the things that I keep saying is, you heard Dr. Levine saying we've been challenged with data. We need to correct that. These disparities that didn't just come up with this pandemic. It's been longstanding. It's unfortunate. African Americans, Latinos, we have high prevalence of diabetes, high blood pressure, cancer, heart disease. So none of that has served us well with this pandemic. But the lack of data, I think, needs to be corrected. I feel very strongly about that, because if you can't measure it, you can't manage it. And I want to see that out of all the challenges that we've experienced during this pandemic, that there's going to be some serious lessons learned, and that we really can move forward and take the opportunity to improve service and address some of these gaps that have been longstanding. So thank you.
Thank you, Secretary Torres, for your riveting remarks. Spot on, especially for our aging population, as well as our Black and Brown populations who are experiencing various comorbidities, further complicated by COVID-19. So thank you for that. So we are now moving into our question and answer portion, and I will turn this over to Jamil.
Thank you, Shana. First, we're going to start with a couple questions. I'm going to try to, as they came in, I would jot some down here. The first question is going to be for Lieutenant Williams. Has the NAACP in the state established a proactive plan to address the act of hate crime against any specific group?
Well, thank you for that question. In particular, as I said earlier, with this COVID-19 pandemic, the Asian American community is being threatened at a higher level across America because of misconceptions surrounding the virus and the origin of the virus. So what the Pennsylvania State Police has done was disseminated a letter to the Asian American community members. We disseminated it in English and Chinese as well, and I believe it may have been translated in some other languages, just to reassure the Asian American community that we will thoroughly investigate any report of hate or bias against them, as well as we have the capability to communicate in multiple languages if they were to call 911 and try to report a hate crime. Secondarily to that, the Pennsylvania State Police, we track hate crimes on a daily basis. Me personally, I get up first thing in the morning and I check the database to see if there were any COVID-19 related hate crimes that occurred throughout the state that the Pennsylvania State Police investigated. And again, I could say with certainty that there were none that the Pennsylvania State Police have investigated. So we proactively sent an outreach letter to our Asian American community members to reassure them that we're going to thoroughly investigate their reports. Hate is not going to be tolerated here in the Commonwealth, and we can communicate with them in a multitude of languages. In addition, our office works with state, federal, and local agencies, including the FBI, Pennsylvania Human Relations Commission, Attorney General's Office, and several other entities to monitor these hate crimes. So if one of our partners become aware of an incident, they need state police assistance, they will proactively reach out to us as well. But we actively track hate threats, hate groups, or any perceived hate crime against any minority group within the Commonwealth.
Thank you.
You're welcome.
Right, the next question is going to be for Norman. Has the NAACP or in the state put forward a plan to address the safety of our Latino workers? And the PA, could you share the plan?
Well, I do not think that we have from the NAACP a plan that is strictly regarding Latino workers in Pennsylvania, but I think that with this pandemic, there is a great opportunity for all of us to work together, especially individuals of color, and for Latinos to embrace the oldest civil rights organization in the nation, the NAACP, so we can do some work. Because at the end of the day, when it comes to Latino workers, the same issues and the same challenges that we are facing are very similar to the same issues and challenges of the African American community of Pennsylvania.
Perfect, thank you. All right, and we're moving right along here. So I have a question for the unemployment. Can you apply for unemployment if you're still working at a job, but your job, but you do not, you'll have a loss of income in your 1099 income?
So yes, in that case, what the individual would want to do is to go to our PUA application. and try to file an application there. There is what I'll call an application checker up front. They're going to answer some questions. And then if the system determines the person should file a regular UC claim, it will give them that message and they can file a regular UC claim. If they're okay to continue on to the application, it will let them through. So again, the Pandemic Unemployment Assistance Program is for those who are self-employed. Of course, a lot of people have that mixture of some self-employment and maybe some part-time employment somewhere for someone else. So, you know, we'll check their qualifications and then they'll be able to proceed with the application.
Thank you. I have a follow-up question with that also. Within the past, we know that there was some layoffs recently done in the department. Are you able to rehire back some of those individuals? It'd be less training that'll be able to be done?
We have brought some individuals back. We are bringing back, as I said, retirees and folks from other agencies. Most of the folks, they weren't technically laid off. They're on leave without pay. So when we recover from the pandemic, as we're recovering, those people will be brought back. Most of those people also were folks that were unable to work from home. And just as all of us have been, I'm from Montgomery County, so I've been in my house since the pandemic began. So they're people who have, for various reasons, are not able to work from home or their job doesn't allow them to work from home. But we want to get those people back as quickly as we can.
All right. All right, I'll turn it back over to Shana. Thank you.
All right, thank you so much, Jamel, for posing those questions. We are conscious of time and we were given a lot to think about and to think about collaborating on tonight. For our closing remarks or further questions, I will turn this over to our president, Kenneth Houston.
Well, thank you, Shana. And I keep moving in my chair. I'm just not used to sitting. I want to, first of all, thank each and every one of the panelists that came tonight to give us some very incredibly important information. I think that as we move forward together as Pennsylvanians, we're united. One of the things that I was very happy to know is that our governor is on top of so many things around the issues that impact people of color, our Latino, our African-American community, and even our Asian community, that he is working very aggressively to ensure and assure that we are all treated with dignity and respect, and we're all treated fairly. And ultimately, the NAACP Pennsylvania State Conference is extremely grateful to him for that. It's refreshing to know that, of course, that our labor secretary is on top of it. I must admit, Jerry, I felt really bad for you, man, when I saw the numbers going up. And I really thought about all the departments and the services that each one of you serve in, and how you were all going to be able to tackle such a huge amount of issues coming forward. Lieutenant Slayton, I'm extremely grateful, and it's refreshing to know that the Pennsylvania State Police Department does have a component to it that addresses the issues of racism and working in communities and monitoring what's going on. And again, this is something that we did not expect. COVID-19 really, I think, knocked us all for loot when it came in. It moved so quickly. I think it just shocked each and every one of us. The Pennsylvania NAACP is going to be hosting a lot of these town halls. We are getting very aggressive in working with, in partnership with throughout our state. We are going to be working very sincerely with our governor We can honestly say that our agenda is very aggressive. The state conference, we're moving forward in a totally different way. No longer will we sit back and not really have the voice that we should have as the oldest civil rights organization in the country. But let me be clear about something, particularly when it comes to my administration in the state conference. We're building partnerships. We want to work with each and every one of you in your respective departments, and we want to be partners to you. We want you to feel comfortable with calling the Pennsylvania State NAACP in your respective areas, and whatever we can do to be an asset to working together with you, we certainly want to do that. We realize that you are taking on a lot of responsibilities. You have a lot going on, but there's a lot of things that we want to do to help you as well. We're trying to identify different areas of funding so that we can help pass out bread, milk, whatever it takes to be an ally and a support in the Commonwealth. That's what the Pennsylvania State Conference NAACP is attempting to do. We're rolling out a very strong agenda that will be forthcoming. You all should know that. We're in communication with all 44 of our branches, letting them know what is going on, and we're being very informative about that. So I hope and I pray that you all will come back and keep us informed, and any information that you have, we will get it up on our website. We will let those that are interested in knowing what you're doing, particularly you, Jerry, with your department, in what you're tackling and in the way that you're trying to do it, so that we can be patient as you try to move your department forward in that system and in that process. And Susan, we're grateful to what you have shared with us in reference to the unemployment compensation piece. We get tons of calls, and we've been getting tons of calls relevant to that respective area. So it is so refreshing to have someone with your knowledge and expertise come here tonight and brief us about that information. And our Latino brother, I mean, you put it so eloquently, we're all in this boat together. And so we have to be mindful of that. I always say that, the NAACP, we have a big tent. That's why we're called the National Association for the Advancement of Colored People. And that means all people. So we got room for our Latino brothers and sisters to come on board, man. Whatever we can do to work together and ally together, we're willing to do that. So you got a friend in the NAACP Pennsylvania State Conference, please know that. And I hope that you reach out to us. And so with that being said, I thank Shana. I want to thank Jamil. I want to thank First Vice President, Mr. Watson, for working with me in partnership, because we call each other partners. We're a team in putting this together. We look forward to doing more of them. And hopefully, again, this will not be the last time that we see each and every one of you. I'm extremely grateful to you all from the bottom of my heart. And I hope, again, that you become partners in the NAACP Pennsylvania State Conference and become members. If you're not. Thank you very much. And thank you, Shana.
Thank you very much, President Houston. And thank you to everyone who joined us tonight. That concludes our first virtual town hall. We ask that you tune in again at this same time next Thursday for our next virtual town hall, where we will feature other local, state, and federal officials and leaders. Thank you and God bless. Stay safe, stay calm, and stay home if you are able. Take care.